So hello everyone. Today we'll be discussing some basic rules in radiology, which will help for the short notes as well as the long notes for the examinations. So we'll start with rule of two. So as we know, rule of two is commonly seen in Meckel's diverticulum. So what is Meckel's diverticulum? It's basically incomplete obliteration of the vitelline duct or the omphalomesenteric duct, the proximal part, resulting in a true diverticulum in the distal ileum in the antimesenteric border. So basically the rule of two is it's seen in 2% of the population, and it is about 2 feet from the ileocecal valve. It is about 2 inch in length, and it is twice as common in males as compared to females, and it has two types of mucosa, that is the gastric and the pancreatic mucosa, and is seen usually less than 2 years of age. So coming to another rule of two, that is 2-2-2 rule, which is commonly seen in subacute infarct. It's a gyriform enhancement pattern, which is due to luxury perfusion, and it actually appears 2 days after the acute infarct, and it persists for 2 months, and it peaks at 2 weeks. That is 2-2-2 rule. So rule of two is over, that is Meckel's diverticulum and subacute infarct. Then coming to rule of three. So rule of three is basically seen in the hydrostatic or pneumatic reduction of the intussusception in infants. This is ultrasound guided. So we usually use normal saline or diluted contrast material to reduce the loops, and it is usually done at the saline solution is kept at 3 feet height, and attempt is made for at least 3 minutes in duration, and a maximum of 3 attempts are made. So this is the rule of 3, and this hydrostatic or pneumatic reduction is contraindicated in case of peritonitis or perforation or shock, and its complication is perforation, which is usually seen if the infant is less than 6 months, and the duration of the intussusception is more than 36 hours from onset, and on color Doppler imaging we don't see any vascularity in the bowel loops. Another rule of three is seen in malignant carcinoid tumors. Rather than rule of three, it's actually 1/3 rule. So actually this particular carcinoid tumor, that is a neuroendocrine tumor in GIT, it commonly occurs in the distal ileum. So 1/3 of this tumors occur in the small bowel. 1/3 have distant mets, and 1/3 are multiple, and 1/3 have a second malignancy associated with it, and 1/3 present with a carcinoid syndrome. So that completes our rule of three. So rule of three we saw in pneumatic or hydrostatic reduction of intussusception as well as malignant carcinoid tumor. Then coming to rule of four. Rule of four is seen in the transient elastography of the liver, where less than 5 kilopascals indicates a normal stiffness. Then up to 9 kilopascals, 5 to 9 kilopascals rules out compensated advanced chronic liver disease if the clinical features are normal, and then adding 4 to it, that is 9 to 13 kilopascals, is usually indicates advanced compensated chronic liver disease, and above 13 kilopascals is highly suggestive of advanced compensated chronic liver disease. So rule of 4 is basically seen in transient elastography of the liver. Coming to rule of 6. Rule of 6 is seen in two conditions, that is, one is the pseudocyst of the pancreas in the management part. Now surgeons don't use this particular rule. They operate on the pseudocyst if it is symptomatic, but earlier this was used very prominently, and this suggests that if the cyst is more than 6 centimeter in size and the ball thickness is more than 6 mm, and the duration of the cyst is more than 6 weeks, it is an indication for surgery. Another rule of 6 is we see in the AV fistula assessment maturation for dialysis. For maturation of dialysis, the AV fistula for dialysis, it has to be 6 weeks old in duration after creation, about 6 mm depth from the skin, 6 mm in diameter, and about 600 milliliter per minute the flow should be present in the fistula. to call it mature. So rule of 6 we saw in pseudocyst of the pancreas as well as AV fistula assessment for dialysis maturation. And then coming to rule of 10. So rule of 10 is commonly seen, as we know, in pheochromocytoma, that is the tumor of the adrenal medulla, where 10% are extra-adrenal, 10% are bilateral, 10% are malignant, 10% are seen in children, and 10% contain calcifications. And another place where we can see the rule of 10 is glomus tumor or paraganglioma, which is a neuroendocrine tumor and a highly vascular tumor, where the rule of 10 is that 10% are multicentric, 10% are bilateral, 10% are familial, and 10% are malignant, and 10% are seen in pediatric age group. Then this rule of 10 basically is seen in pheochromocytoma and glomus tumor. Coming to rule of 12, that is Harris rule of 12, that is seen in atlanto-occipital dislocation. That is the basion dense interval or basion axial interval is more than 12 mm. Basion dense interval or basion axial interval is more than 12 mm. So rule of 2 we saw in Meckel's diverticulum and subacute infarct. Rule of 3 in hydrostatic or pneumatic reduction of intussusception and malignant carcinoid. Rule of 4 we saw in transient elastography of the liver. Rule of 6 in pseudocyst of the pancreas and AV fistula assessment for maturation. Rule of 10 in pheochromocytoma and glomus or paraganglioma. And rule of 12, Harris rule of 12 in atlanto-occipital dislocation.